Okay, good afternoon, everyone. Again, this is Natalie Galusha with Village to Village Network. We're going to go ahead and get started this afternoon. We've, in lieu of what we had originally planned, put together a little bit of a program for those of you who are still able to tune in and participate with us this afternoon. As you all know, today we were to celebrate the 15th anniversary of Beacon Hill Village and the Village Movement. So we're very excited that there were many of you that were still able to join us today. I'm going to turn it over in a minute to Mandy Summerson, our president, and then we also have one of our other board members, Sally Van Sickle from Austin, Texas. A few people were able to make it to Boston, including those two, so they're having a good time with some other folks from Beacon Hill Village there. And then we also invited Roscoe Nicholson from Mather Lifeways Institute on Aging in Evanston, Illinois, and he's going to provide an update and overview of some of the latest that he's been doing with Dr. Andy Charlak and Carrie Graham at the University of California, Berkeley as well. So that way we'll be able to provide a pretty broad but good snapshot of the village movement as a whole, so everybody can kind of get a picture of exactly what's been going on over the last couple of years with all of our villages. Right now, to date, there are about 215 villages that are open across the country, and then there are also about another 130 that are in development as well. So everyone that's out there participating right now is part of this exciting and growing movement. And again, thank you all for joining us. And now I'm going to turn it over to Mandy to welcome you.
Okay. Hi, everybody. Again, our apologies for this, I guess, lack of being able to pull off this event tonight. We really did try hard, and I know Beacon Hill had tried really hard to actually everything in their power. The library had closed here because of the weather, which is where the event was to be hosted. And so we tried Plan B, but Plan B wasn't going to happen either. So, but it does look like we are trying to plan for something in the future, and we will let you know as soon as that is arranged. But meanwhile, I think we're going to have some good information to tell you about, with some updated information about research that has been done about our villages, and we look forward to hearing from Roscoe.
Okay, thanks, Mandy. Okay, so just a couple of little housekeeping things real quick before I turn it over to Roscoe too. Like I mentioned before, some of you were able to join. The way the audio works in our webinars is just one way. So we won't be able to hear you over the phone or through the computer, but there is a chat pod that you can feel free to type in any questions or comments that you have at any time that we can all see. If your screen is not in the full screen view, if you hover your mouse toward the bottom portion of the screen, you'll see a little toolbar with a little icon that says chat. So you can just click on that to open that up and be able to chat to everybody. If you are in full screen, you'll actually want to hover your mouse toward the top of the screen. And again, the same toolbar will come down where you'll be able to see the chat pod. So Nisha's on as well, and her and I will be helping to facilitate and moderate some of those questions. We're gonna let Roscoe go through his presentation, and then once he's done, we'll open it up for more discussions. And of course, at that point, you know, you can ask questions about anything that he just presented on, or any other questions or information that you would like for us as a whole. We are going to keep this webinar to an hour, so we will stop at 6 p.m. Eastern. And it is being recorded as well, so if you want to share it with other members or other people who might be interested in seeing it, we'll be making it available for everyone who had registered for today's event. So with that, I am going to turn it over to you, Roscoe.
Okay, thank you, Natalie. Glad that I'm able to participate in this event. You know, the villages have been a really exciting movement to me for a long time. You know, I think it's very exciting as a researcher in the field of aging to see the kind of grassroots energy and dedication that we see in the village model. You know, really that, you know, the villages are, you know, driven by older adults who are identifying what their needs are in their local communities, what kind of niche any individual village can fill, but really taking the reins and taking control over how they want to proceed, and enjoy the type of life that works best for them and their community. So the Villages movement is extremely exciting for those reasons, and from a researcher's perspective, that makes it also very fascinating to study. As we'll see, the Villages movement is really growing quickly. I've been involved with research on the Villages movement for I think it's for about 3 years now, and I've really had the benefit of working with my colleagues Andy Sharlock and Carrie Graham at the University of California, Berkeley, as well as with Natalie and the Village to Village Network and many other villages nationwide to help us look at the state of the movement. Kind of launching a grassroots movement is not easy, and the enthusiasm goes in a lot of interesting different directions. So for those of you that aren't familiar with the Villages movement, there's a saying I heard a lot doing some interviews, which is, if you've seen one village, you've seen one village. So if what I'm describing here doesn't look like the village that you're familiar with, we're looking at a lot of sort of averages and things like that. But in addition to the grassroots side of the Villages movement, it's really great to see the adaptability of villages as they try and sort of find what their niche is locally for the population that they serve for their communities and their membership. Okay, with that out of the way, let's get to the research, the exciting data that I'm sure you will all enjoy as much as I do, and we'll bring this up. And 1 second. Okay. There we go. So, today I'm going to cover 2 areas of village research. One is one that I've been more involved with, which is village organizational development. We've been looking at village characteristics, types of villages that are out there, looking at factors associated with the growth and sustainability of villages over time, looking at the cost effectiveness of villages, and challenges and best practices. The other line of research that has primarily been done by my colleagues Andy Sharlock and Carrie Graham at UC Berkeley is looking at surveys of the members themselves. What services are they using? What sort of satisfaction are they expressing with the villages? How might villages be affecting their physical and social well-being? And how are villages supporting the very important goal of older adults having the ability to age in place? So I'm going to start with a snapshot of our villages in 2016. This is data that was collected over last calendar year from all of the operational villages that we were able to identify through the help of Village to Village Network and others. And I'm just going to go through some of the highlights. For some of you that have been working with villages for a while, some of this will seem familiar. For others of you that may be less familiar with the Villages movement, here's what we hope is a good snapshot of what villages are and what villages are doing. So since this event was a celebration of an anniversary of Beacon Hill Village, I wanted to give you an idea of the year, when different villages were offering services for the first time. So these dates are all when the villages began their operations, not sort of the first planning, formation periods there. So of the villages that we surveyed, 10% had launched prior to 2008. Almost half of the villages had launched are between 8 and 5 years old, so launched between 2008 and 2011. almost a quarter are 3 to 4 years old. And I think this is really interesting and important as we talk about village growth. Nearly a quarter of all villages are only 1 to 2 years old. So, there are more villages coming online, every year, and, villages in formation and those that are opening their doors and offering services continues to grow. What about the characteristics of these villages? And again, this is including, this quarter of villages that are really quite young still. Average number of villages that we see is 146. The average number of new members that the villages reported gaining in the calendar year, end of 2015 to the start of 2016, was 36. So we're seeing, we're seeing a lot of growth there. Some of the older villages, as they mature, this levels off a bit. But on average, we're seeing a decent amount of membership growth. And sort of taking these figures and some other data, right now estimates suggest, for our best guess, is that almost 25,000 older adults are currently being served by villages in the United States, which I think is really remarkable considering the age of the villages movement. And I think that's something that the villages should be applauded for on this anniversary of Beacon Hill founding. Other characteristics of villages that we've looked at is the geographic locations of villages. So we'll see that about a third of all villages are urban, another third, a little over a third, are suburban. We have about 13% of villages are rural, and I think that's a population of villages that we'd like to look a little more closely at to see how a rural setting might impact villages. And then we have again about 16% that are some mix of these other categories. When we hear about the villages, they're really we really hear about them in the context of providing services and be organizations serving older adults. But we found it really interesting when we asked about the membership age requirements of villages. We found it really interesting that 10% of villages are open to all ages, including children and adults. But another 11%, the membership is open to all adults over 18. So we've got 1/5 of all villages really don't have much in the way of age membership limitations. And then when we look at the other age requirements for membership, again, now you can certainly volunteer without being a member, and we've got lots of young volunteers within the villages. But about a third of all villages, they're open to adults 50 years and better. And again, as we see those numbers, 55 and 60 years old are much more common, and it's very rare for the for the membership age cutoff to be at what we think of as sort of your standard Social Security type of age of retirement of 65 and older. So let's turn to the services that villages are offering. And although I'd said earlier that if you've seen one village, you've seen one village. What we have on the screen here really does get at a lot of the sort of core functions and core offerings of villages for their membership. Here we've got the list of around 90% or more of villages are offering these particular services. Highest among them, and I think what in discussions become one of the really characteristic features of villages as compared to other organizations aiming to serve older adults is 95% of villages are hosting social events. The social connections that villages can provide is really a core part of the bread and butter of what villages do, and I think that shouldn't be overlooked, as we also look at some of the services that villages are providing to members. That really the hosting of social events is really a core aspect of what villages are doing and how villages are bringing older adults and others together. But we do have 94% of villages are offering some sort of transportation services. Clearly this is major service that really is very important for helping some older adults to age in place. And again, it's I think from my experience, it's also very much tied into sort of the ability of some village membership to attend the kind of social events that villages are hosting, in addition to doctor's appointments and other kinds of assistance that that transportation may be needed for. We also see that villages are offering a lot of programming for their membership. So 90% offering classes or educational events. 90% of villages are also offering some sort of companionship service for their memberships. And we also see technology assistance. As we'll see later, I'll spoil a later slide and let you know now that technology assistance is actually an area where villages are increasing. We have seen a trend towards more technology assistance being offered by villages overall. Now, in this next slide, I just wanted to show you another few services that are offered by a really large proportion of villages. Shopping is a big one. Information and referral to outside services is done by 84% of the villages. Home repair or maintenance is there for 83%, and 79% of villages are offering health promotion programs. I came into the research on villages and examining a health promotion program in a village setting, and so it was really interesting for me to see that from 2012 until 2016, the villages offering health promotion programs has jumped by about 25%. So in 2012 data, only about 50% were offering health promotion programs themselves. Now, I should mention again, this is what's offered by services offered by volunteers and staff. But the increase in villages offering health promotion programs themselves has jumped. And so here we are. Here's that comparison of what's jumped between 2012 and 2016 that I alluded to earlier. So it's those health promotion programs. More villages are offering housekeeping and home repair. More villages are offering technological assistance. And discounted memberships and discounted services are also seeing a noticeable and statistically significant increase from 2012 until 2016. What villages are offering a little less themselves is assistance coordinating healthcare or social services. But as we turn the page, and again, I mentioned that villages are also identifying sort of the niche that they fill within a particular community. We also looked at services where villages are referring to outside providers, and we also think of this as a very important service that villages can offer their members. That this referral to sort of where members and other older adults in need can go to get some of the things that they might need is a really important part of what villages are doing. So again, we see here, 60% of villages are referring people to outside providers for home modification or home safety assessments. Again, home care, personal care providers offered by 58%. Care coordination of social services, is more often being referred to outside providers that may exist in the community being served by the village. And then we also see, health promotion programs offered by other people other than the villages. Gardening services and technological assistance are also being referred out to outside providers. So between what the village themselves offer and what they can refer their membership to, we're really seeing villages being a pretty incredible resource for their membership and for their larger communities. Now, another thing about the villages that makes them unique is the villages are very volunteer-driven. So we see here that for the staffing of villages, 80% of villages have paid staff. But if we look more closely at this, it comes out to an average of 2.1 paid staff members per village. And when you dig even deeper, those average of 2.1 paid staff members are not always full-time. If you look at the equivalent of what a full-time staff person would be, on average, the villages are looking at the equivalent of 1.4 full-time employees. And we also see that the ratio of village members to each paid staff member is about 80 to 1. So, you know, with that limited amount of paid staff on average, you know, how is a village able to do all of the things that I described above? And well, the answer is the volunteerism. You know, the volunteerism has been a huge part of the villages from the beginning. But, you know, villages really could not operate without the assistance of the village volunteers. And these volunteers may be members, or they may be non-members. Those proportions will differ from village to village. But you know, we saw in our data that the average number of volunteers for a village is 82 individuals, and the average ratio of members to volunteers is 1.9 to 1. Now that looks very different from the ratio of village members to each paid staff there. So you really see you know, members and volunteers helping each other, and I think this is a real demonstration of, you know, the mission of villages and that sort of grassroots, you know, we're going to bond together and help each other ethos of the villages that comes through so much when you go to conferences and other gatherings of village members, staffs, and volunteers. As for the membership types, almost all villages will offer an individual village or a household membership. But we're also increasingly seeing about 47% of villages were offering tiered memberships. And the most common type of tiered membership was a social or no services membership that was the most common. And I think this is you know, this really speaks to the attraction of the villages to individuals that may not be at a point where they need services themselves. You know, these no services, you know, memberships, it's like, you know, for somebody that, you know, doesn't need transportation assistance at this point, but would, you know, is really drawn by the social mission and social events that a village holds. And so this is a way for villages to attract this type of membership, and sort of, you know, build that population, and then a lot of these individuals, as they have needs that make aging in place a little more challenging for themselves, then would transition to a full membership. Some villages also have memberships that are for people that just sort of support the mission of the village as a whole. But tiered memberships are becoming increasingly more common across the villages. We also saw that 72% of all villages offer discounted memberships. I didn't include the data on this slide, but that's another really notable increase in the data compared to 2012. And I think, you know, I think some of what this also speaks to, and I didn't include a lot of the financial type of data here, but this also, you know, really speaks to the village's growing capacity financially to support discounted memberships and to support that population. So that was another very noticeable jump that we saw in the data when we looked at 2012 to 2016. So turning again to some of the, you know, village growth and resources, you know, in general, you know, as I was mentioning at the start of this, you know, here's some of the data. When we first started looking at the organizational field of operational villages, which is a fancy way of saying the villages that met our criteria, that we would include them in some of our surveys. You know, in 2010, we were looking at about 35 operational villages. By 2016, that number had more than quadrupled, and that's a really remarkable growth rate in just 6 years. And since 2012, we're also seeing that villages are more likely to have more formal collaborations with other organizations, you know, which speaks to villages really kind of, you know, entrenching themselves and building webs within the local, within their local communities with other organizations with similar missions. So, you know, it really went from an average of less than one formal collaboration with other organizations when we surveyed villages in 2012 to an average of about 6 collaborations. And we felt like that was very notable and very important. Now, who are these collaborations with? Well, that could be social service agencies, hospitals and health clinics, home health agencies, religious institutions, government agencies, as well as senior living organizations are also really getting behind the mission of the villages and recognize the importance of aiding older adults in aging in place if that's what they prefer. We're also seeing a great amount of awareness of the villages within local communities. So 76% of the villages in our survey reported that government agencies in their service area are very or somewhat aware of the village. And 69% reported that the elected officials in their area perceived a need for the village. They recognize the need for the village is found, and they see it as fulfilling a need for their local community. We're also seeing advocacy by villages themselves. We're seeing villages sort of, trying to get out messages about what villages can accomplish, and to really sort of speak for older adults in their community and their needs. So we had 62% of villages reported doing some advocacy work to help or impact a larger community. And some examples of this is, trying to work for some changes in services or programs for older adults. Sometimes it's advocating for changes in specific public policies. Another one that was very common was these public awareness campaigns on the needs for older adults. And some villages, in line with some of the work that's being done in things like age-friendly cities, and by other groups, as well as sort of disability and accessibility groups within the organizations, are advocating for changes in accessibility of the physical environment in the area that they serve. So we're seeing villages reaching out to really try and speak for the needs of older adults in their communities beyond just the needs of their members. And as I mentioned earlier, the other part that we see of villages, and something very characteristic of villages, is this perception of villages as a movement, as sort of connected to a larger networks of villages, and really working together towards some of these common goals, and really helping each other, relying on some of the expertise of other villages. We had 96% of the villages that we surveyed were part of the Village to Village network, and almost half of the villages were also part of regional coalitions of villages. And I conducted some additional research that I'm not really going into much here, looking into the phenomenon of other local and regional coalitions of villages. And these were really ways that people in villages, both the staff and board members and others, could form closer bonds and connections with people at a local level. And some of that is just sort of the importance of face-to-face interaction. And in other cases, it's advocating for sort of specific policies at a state or local level, or dealing with common issues that not every village may have, such as snow removal may be an issue that certain villages in the Northeast perhaps would be advocating for, whereas less of a concern for the California villages. The other research that's been done, and this has been done by my colleagues Andy Sharlock and Carrie Graham, is they've been conducting some surveys of village members. And I'm going to also show you, briefly some of that research that they've done. I'll do my best to answer questions on this data if people have it, but I will confess that this is not research that I'm as intimately familiar with as what I just presented. So let's look at the characteristics of village members. Age-wise, we see that from these surveys of members themselves, we see that 42% are 74 and younger. 37% are between the ages of 75 and 84, and 22% are 85 and older. We also see that 72% of village members are female. About a fifth of village members have no college degree. A quarter of village members have college degrees, and this is a very educated group membership, and all with 58% reporting having a graduate degree. We also see that in the household composition, 45% of village members live alone. And again, this is another point of data that really speaks to the importance of the kind of social connections that villages can provide and enable. We do see that for the most part, village members are in quite good shape at this point. 58% reporting their health as very good or excellent, and another 28% as reporting it as good. So only 14% of village members are reporting their health as fair or poor. As far as the member involvement in their villages, I wanted to go through how long these members that we surveyed had been in the village. About half of them had been in the village for 1 to 2 years. Very few had been in the village for less than a year in this survey. A quarter had been in the village for 3 to 4 years, and about 20% had been there for 5 or more years. And of this population, we see that 46% of these members had volunteered for the village in some capacity in the past year. As far as these members' use of services in the past years when we surveyed them, 67% had attended village-sponsored social or educational events. 35% had called the village for information and referral and advice. 27% had used transportation services, and 22% had technology assistance services. As far as the impact of the villages can have on social and civic engagement, we asked sort of what members felt that village membership had enabled, and we see that 56% reported that it increased their sense of connection to other people. That it had increased their ability to count on other people. 30% said they were getting together more often with friends and neighbors. 29% are attending meetings of organized groups more often, and 27% are doing volunteer work more often. And again, as we see in the other research, the importance of this kind of social and civic engagement as we age cannot be overemphasized. The data is really very clear on that, and again, it speaks to the importance of that social mission that the villages have in providing these opportunities for older adults to be more engaged. We also look at the confidence and ability to age in place, and again, this is another really core part of so many villages' missions. And so when we asked members about that, 50% said that due to their membership in the village, they would say that they had a improved ability to get the help they need to live in their current residence. This was largely in terms of transportation services that would permit this, as well as information and referral services that they were getting that could assist them with their home. 29% reported an improved ability to take care of their home. 20% reported it being easier to get to places that you need or want to go. And then when we looked at the who seems to be benefiting most from village membership from this data, and I didn't want to go into the reads on this one. But we saw that using village services is impacting members in all ways. It's helping with the health and well-being for certain subgroups of village members, and it's also leading to reports of increased confidence and ability to age in place. We're also seeing some evidence that those village members that are the most vulnerable, women, people living alone, those with lower education and poor health, are perceiving positive health impacts. For other village members, in a lot of cases, they're not yet encountering, sort of major health challenges. Again, remember how many of them reported being in, very good and excellent shape. But for those that are the most vulnerable, we're seeing some evidence there. And we're also seeing that younger members, men and newer members, are the ones that are really seeing, more impact on their social and civic engagement through their membership in the villages. And other data suggests that that men as they age are more likely to withdraw from some of their social networks. So again, this is really important that we see that there. Okay, well that's that's it for the for the main part of my presentation in the time that I have. I hope you found this very interesting. We've also just recently completed 2 research briefs related to the organizational studies that made up the majority of my talk here. And those can both be downloaded from the Mather Lifeways Institute on Aging website. If you may not want to scribble down those addresses, or may not be able to make them out. But you'll be able to find those through the Mather Lifeways Institute on Aging website, or the Village to Village Network website will be also providing connections to these to this research. And I've also included my contact information, rnicholson@matherlifeways.com, as well as the email address for the Village to Village Network. If you're looking for additional information on anything that I've presented here, or have additional questions that we can help with. So I want to thank you for your patience. I hope you find this data as fascinating as I do. I mean, it's not always the case, but and I also sort of wanted to acknowledge and thank the Center for Advanced Study of Aging Services, which are my colleagues in Berkeley, Mather Lifeways Institute on Aging, where I'm working, as well as the Archstone Foundation, the Retirement Research Foundation, have all contributed in some ways to this research. And with that, thank you all very much. Happy to answer any questions.
All right, thank you very much for that, Roscoe. We have had a couple of questions that have come in already. One of them, which I know you guys looked at this a little bit, I don't know if you'll recall off the top of your head, but Jessica asked, can you tell us what % of villages that launch last at least 5 years?
So we have collected some of that data and are just now looking at that. That'll be some of our work coming up in 2017 to look more closely. Some of our data that we've looked at ask villages to rank their confidence in their ability to be in existence. Was it 5 or 10 years? In 10 years. So, average rating on a scale of 0 to 100 and confidence that the village will be operational in 10 years was 77, which is quite high, especially considering that for grassroots organizations with small staff, poses a lot of challenges. When we also wanted to look at villages that had ceased to offer services, we initially identified about 20 villages. But when we looked more closely, it wasn't so much that all of these villages were closing, but in a number of cases, these villages had transformed into some other type of organization serving older adults. Now, I don't have the details on exactly what those looks like or not. So that'll have to be one where we stay tuned.
Okay, great, thank you. And then the next question from David was, what is the operational definition of village member that you use?
Well, so I should have mentioned this. Apologies. I meant to bring this up earlier in the presentation, while the majority of villages do do have membership dues. In those cases, it's pretty it's pretty straightforward. The membership for a village is the number of individuals who are paying for paying these membership dues. But there's also a number of villages that operate under a no dues model. And in those cases, those villages are reporting their memberships to us. But as we looked at the survey data, in a lot of cases, it seemed like they were using some pretty different criteria for reporting the number of older adults that were members or number of older adults served. So that's something we're going to have to go back and look more closely at. That's also going to be another one of the research projects that we're pursuing in 2017. There hasn't been as much done on the no dues model for villages, and that's something that I'm very excited to look into as we move forward in this next calendar year. So stay tuned.
All right, great. Then the next question, both Joyce and David asked similarly, what is the average cost of membership? And then also, what is the range of the membership fees?
Okay, one second. I do have that. Okay. All right. So looking at the average cost of an individual membership, that average cost right now is $431 annually. But the range is really significant. That ranges from $10 as an annual membership fee all the way up to $900 for an annual membership. And we see, it looks very similar for household memberships. So for a household membership, the average is $601, and that ranges from a low of $15 to a high of $1,300 for a household membership. Now, when that said, we also asked about discounted memberships, and as I noted earlier, about 3/4 of villages are offering discounted memberships now. At present, the average cost of a discounted membership for an individual is about 1/4 of what a standard individual membership costs. So that's at about $110, and that can range from $0 to about $325. And we see similar, and those figures look pretty similar for the discounted household memberships as well. Also, again, I should mention this is for sort of your full service memberships. We also looked at tiered memberships, which are also going to come in lower than the standard membership cost. Because you're these are members that may not need all of the village's services at this point.
Okay, thanks. And a similar question, what percentage of a village's revenue is from dues or fees versus from outside sources?
Boy, I really regret not taking these out of the PowerPoint. But yes, we do have that, and again, this is all in the research brief that I mentioned earlier with really pretty graphs. One of the reasons that I'm very interested in these no-dues villages is that we see for villages that on average, 44% of all village revenue is coming from membership dues. So that makes this no-dues model very interesting to look into in terms of how that works. Other major sources of revenue, 22% is coming from individual donations. About 12% on average from grants from private foundations, about 10% from fundraising events, and then it gets a little smaller. Business or corporate donations are only making up about 6%. Government grants or contracts, while some individual villages have had a lot of success here, on average, that money is only making up 5% of village revenue. And then we've got the always popular other category, just makes up about 2%.
Okay, great, thank you. Okay, let's see. And then our next question was, how many villages are there that have not opened yet? So right now we're aware of about 130 villages that are somewhere in the phases of operation but have not yet opened and launched. And then the next question was, what models are effective for clinical supervision for volunteer coordinators or staff who manage member services but don't have a clinical background? I will take a stab at answering that one. So, so one thing we've recently, well, I guess almost a couple of years now, we have a monthly call. It's put on by Melissa Susser at Capitol Hill Village. And they really put together a little bit more of a unique model for addressing the frailer needs of village members. And they have a specific volunteer program. These volunteers go through a little bit more intensive training, and then they're also matched one-on-one. So one volunteer to one member, and then that member always has the same volunteer, and vice versa. Sometimes a volunteer might work with a couple of different members, but for the most part, keep it down a little bit. And through that and through some other ways, and in Capitol Hill Village, Melissa herself and some others are also social workers as well. So they're able to provide a little bit more of that supervision. But for the most part, the services that are coordinated and managed by villages aren't necessarily, or really aren't, focused on the medical side of things. So there doesn't always need to be that clinical background. That's when you would want to partner with another organization in your community, such as a home health agency or a geriatric care manager or something like that, to be able to provide that guidance as well. Mandy, do you have anything to add to that?
No, it's exactly what I was going to say, is that you don't necessarily have to have a clinical background, but definitely when you know it's over and beyond your scope of work, to reach out to those resources in your area, and to definitely reach out to geriatric care managers or other social workers that could help the individual.
Okay, great, thank you. Okay, and then another question, I think, Roscoe, for you. Do you have any stats on engagement? In other words, how often do members actually engage with other members?
You know, again, unfortunately, that's going to be an area that I'm not as familiar with. You know, really, my colleagues Andy Sherlock and Carrie Graham and the folks at UC Berkeley have really done a lot more of those member surveys. So unfortunately, I'm not going to be able to get at that. You know, but I also think it's you know, it's interesting, just sort of anecdotally from discussions with individuals, is, you know, we also see a variety of the ways that members use their their membership. So you know, I think that, you know, for some members, a village membership is a sort of just in case kind of thing. And what we also see in a number of individuals, and this has come up in different focus groups that I've conducted, that are signing up as members of a village, while they're still working, when they're far from needing services, maybe when their work and life schedules are not permitting them to participate in village social events, but are going ahead and signing up for members because they support the mission of the villages themselves. So I think, you know, all of that needs to be kept in mind.
Okay, great, thank you. All right, and we have a question from Sherry, and she asks, we are interested in sustainability, how the most successful villages deal with this issue. Roscoe, do you have anything on that? Otherwise, I can take a stab at that one too.
Natalie, why don't you start taking a stab, and let me pull up what I have on that while you start here.
Okay. All right, great. So I know one thing that we found is, you know, as Roscoe was just talking about with, you know, the revenue structure and all of that, that it's really important to diversify your revenue structure as much as you can. As we know, the dues aren't necessarily always going to cover your entire budget. And so being able to fill that in with different grants, donations, fundraising activities, all of those sorts of things are going to be really important to continue having a stream of revenue coming in to support your organization. And beyond that, it's also really important, that you're keeping your village very membership driven. So checking back in with your members, making sure that the services being offered are what they want and what they need. As those needs and those wants might change over time too, or as your membership grows and changes a little bit. We also had a question, I think from Sherry, about, what are the main reasons that some villages fail? And the little bit that we do know from that already, one of those reasons is because the membership buy-in isn't always really there. And if you're not creating this organization and continuing to run it for your members, then they're not necessarily going to want to continue participating in it. And so then that can hurt the overall sustainability of the organization. And again, and that goes back even to, whether or not you put on social activities and what types of social activities are put on as well, just again, to try and meet those needs. And then, a little bit back to answering both the questions about why they fail as well. Another is, the overall sustainability of the funding streams, and whether they're not able to meet their budget every year. We haven't thankfully seen that very often yet, but as Roscoe said, that's something that he's going to be looking into a little bit more over this year. So we'll have more data overall on that coming soon.
And I'll just add to that, from the data that's in this research brief. Again, stay tuned. But we also asked about, when I mentioned the confidence and sustainability for villages, the ratings of how likely do you feel like your village is going to be operational in 10 years. We also followed up asking about the reasons for confidence or lack of confidence in the sustainability. And the most common reason mentioned that villages gave for being confident in their sustainability was the fact that the village was fulfilling a previously unmet need in the community, or that there was a high level of community support for a village. Another very common reason was, like Natalie mentioned as well, was the strong commitment of the members. Also having a strong volunteer program and sort of making sure that the volunteers are feeling supported and appreciated, and that your village is able to attract volunteers both through your membership and outside of your membership. And then less surprisingly, many villages reported confidence sustainability because they felt like their village had relative financial stability and sustainability. And again, I think when we talk about that, that speaks to sort of the diversified income that some villages are able to acquire. As far as the challenges or threats to sustainability that some villages reported on, these challenges were in many cases sort of the flip side of the reasons for confidence. Financial resources were the most commonly cited barrier or challenge. 35 villages mentioned, that one challenge was, making sure there were sufficient numbers of volunteers to meet the members' needs. Recruiting new members was cited as a challenge, as well as was sort of getting commitment from community members. So those were, those were really. Were really the biggies. Something else that we want to do as we look at this survey data in more depth is look at some of the things and sort of how newer and older villages look in terms of the sort of what what happens when a village sort of moves beyond that initial energy of the founding members and into certain levels of maturity. How do these things change and evolve over time?
All right, great, thank you. Okay, and then we had another question, which I'm actually going to turn over to one of our other board members who is there in Boston, Barb Gage. And we had someone specifically ask 2 questions that I'm going to put out there. First was, how do villages help save on Medicare and Medicaid? And then the other question was, will change of administrations in Washington impact village-to-village movement, funding, and research?
No answer.
Yeah. Those are great questions. Thank you for passing it over.
You're welcome.
Natalie passed it to me because I'm the head of the research committee and a DC expert on Medicare and Medicaid issues, working closely with the feds. And I think that there are a lot of savings out there in terms of avoiding adverse events. So when we're talking with our clinical community members, our hospitals and our home health agencies and our nursing facilities, we are the eyes and the ears in the community. We notice if a neighbor hasn't come out. We can make a call to the village and have a local neighbor come visit. So conceptually, the villages should be associated with lower healthcare costs in the Medicare program and the Medicaid program, because the Medicaid are just, while they maybe have less income available to them, fewer resources, they too are often the elderly and people that have disabilities, so they may be needing a little assistance to live independently. But there are lots of organizations in the communities, and one of the strengths I think that we'll find over the next few years is that collaboration with the existing community groups, which will further save costs for both programs. That said, the study hasn't been done yet to document that. There's been a lot of work on readmission reductions and the effect of having somebody check on somebody, which is functionally what we do as villages. So reason has that we would reduce costs, but to conduct that type of study, we'd need members' authorization to use their claims and do a nice quasi-experimental study that would, I think, prove that we save money. In terms of the second point on the new administration, it's a very unpredictable administration. If anything, given the way the villagers have traditionally been activists, been people who stood up and said there's a problem and let's deal with it, I would think that it would be positively viewed by those who are trying to reduce federal costs and structures and all of that. And the more that the agencies, certainly we've seen it on the local levels, where agencies' awareness of members, of villagers, local community people willing to help them do their job at no cost to them is viewed positively.
All right, excellent. Thank you, Barb. I know there are, oh, go ahead, Roscoe.
I just wanted to add to what Barb said, and you know, again, going back to you know, some of the self-reported health of many members. You know, my colleague Carrie Graham recently, looking at this data, has started also saying that we need to think of some of what Villages does, thinking of it along the lines of preventative health efforts. You know, you know, that many members are in very good health, you know, when they're joining, but you know, both in terms of social support, so you know, social activities, the sort of looking in on each other, and those sorts of things that Barb mentioned. That this is another very important way to look at villages in terms of offering a real preventative health service. And as we know, you know, more and more preventative health measures have been, you know, really advocated in terms of, you know, paying off in spades, even though that payoff, you know, may not be in the near term.
All right, great. Thank you. Yeah, go ahead, Barb.
That was a great point, Roscoe. And for those of you who may be less experienced with your local community organizations, the Centers for Disease, CDC, makes funding available in the areas of health promotion, and the area agencies on aging often carry out those programs, as do other medical members in your community. So shout it out loud and wide in your local area that your members are there, and if there are federal or local efforts available, that you have the volunteers.
All right, thank you so much, everyone. Thank you, Roscoe, and all of our board members that joined us from Boston, and Nisha for being here today. I know there are a few questions that we didn't get answered, but we will address those outside of this webinar. We want to be respectful of everyone's time this afternoon, so we are going to wrap up. But I just want to say thank you so much to everyone for being here today and for participating. Again, sorry our plans didn't work out quite as we had hoped, but it was lovely still to be able to spend some time with you this afternoon. And we just want to thank you for all the wonderful and hard work that you are doing with all of your members, and the broad impact that you're making, as can be seen throughout the research and what Roscoe just presented today as well. Mandy, do you want to say anything to close?
No, just I wanted everybody to keep in mind that we are looking to reschedule our Gowandi event later this summer, and we will be in touch with you. And so again, good night, everybody, and thank you.
Yep, thank you everyone, and we'll make the recording and materials available later this week from this webinar as well. So take care. Thanks, Roscoe.
Thank you, everyone.